Assalamu alaikum, my lovely nurses. I hope you are fine. So today our topic is personality disorder. Personality disorder. So in the personality disorder, first we will describe this one, the description. So in that description, how we can tell what is personality disorder? The personality disorders involve the consistent expressions of various inflexible maladaptive behavior pattern or traits that may impair functioning and relationship. So this is personality disorders that involve the consistent expression of various inflexible maladaptive behavior pattern or traits that may impair functioning and relationship. The client usually remains in touch with reality and typically has a significant lack of insight in self-identity and interpersonal behavior. But we can say empathy and intimacy. So the client usually remains in touch with reality and typically has a significant lack of insight in self-identity and interpersonal behavior. For example, empathy and intimacy. Now, if the personality order patient, he already have personality disorders, and if the patient have stress, what stress will do to the personality order patients? The stress exacerbates manifestation of the personality disorders. Patient already have personality disorders. Now patient have stress. So the stress what will do? Exacerbates the manifestation of personality disorders. One more thing keep in your mind, the personality disorders not directly related or associated with the effects of substance use, substance misuse or a general medical condition for example head injury. head injury. So personality disorder is not directly related to the or associated with the effects of substance misuse or a general condition, medical condition, for example, head injury. Now, how we will characterize this personality disorder? So we will talk about characteristics of the personality disorder. Number one is poor impulse control. Poor impulse control. So what is poor impulse control? The poor impulse control is number A, acting out to manage internal pain. Acting out to manage internal pain. Number 2, forms of acting out include physical and verbal attacks such as yelling. The personality disorders patients, what they are doing, yelling and swearing, self-injuries, behavior such as cutting on skin, and banging the head, punching himself, manipulation, substance abuse, and sexual behavior plus suicide attempts. So this one is the mostly the personality disorders patients are behaving like this. And number C, the client may be preoccupied with such things as self-religion, religion or sex. So this is all included in the poor impulse control. Now we will talk about mood characteristics. So in the mood, number A, we will talk about A, B, C. In the number A, may experience abandonment and depression. Number B, moods may include, which type of moods? Rage, guilt, fear and emptiness. that is included in the mood characteristics. Number 3, impaired judgment. In the impaired judgment, number A, difficulty with problem solving. Difficulty with problem solving. Number B, inability to perceive the consequence of behavior. The consequences of behavior. Number C, difficult to understand the surroundings. Now, the number 4 is, we are still talking about characteristics. So, number 4 is impaired reality testing. Impaired reality testing. Distortion of reality. Distortion of reality and often projection of own feelings. And often projection of own feelings onto others. So what this personality disorder patient are doing, they are impairing the impaired reality testing, the distortion of reality and often projection of his own feelings, what they are doing onto others. Number 5, impaired objects relation. Objects relations. Rigid and inflexible. Rigid and inflexible with difficulty in intimate relationships. Intimate relationships. Number 6, impaired self-perception. Self-perception, distorted self-perception. Distorted self-perception and experience of self-hate. Experience of self-hate or self-idealization. Idealization. Number 7, impaired thought process. Impaired thought process. What will happen in the thought process? We will divide it. For example, number A, concrete or difficult thinking. Or difficult thinking. Number B, difficult concentrating. Difficulty in concentrating. Number C, impaired memory. Number 8, impaired stimulus barrier. Impaired stimulus barrier. In the impaired stimulus barrier, what will come? Number A, inability to regulate incoming sensory stimuli. Incoming sensory stimuli. Number B, increase excitability. Increase excitability. Patients are too much excited. Excessive response to noise. Excessive response to noise and light. Number D, poor attention span. Poor attention. Number E, agitation. Number F, insomnia. So if we will talk about the types we have actually 3 types of personality disorders: cluster A, B and C. In the cluster A, different types, cluster B, different types, cluster C, different types. So inshallah in the coming lectures we will talk one by one, otherwise it's a very long lecture. So inshallah the next lecture we will talk about cluster A personality disorders, and then cluster B and cluster C. I hope you like the lecture. If you like, please share and subscribe with your friends and colleagues, and take care of yourself and your family. Allah Hafiz.